Hi, I'm Dr. Chris Kelly, and in this video, I'm going to be talking about the test known as the Transesophageal Echocardiogram, also known as a TEE. A TEE is a test performed by a cardiologist, and it's a semi-invasive ultrasound of the heart. Unlike a regular ultrasound of the heart, in which the probe is on the skin of the chest, imaging the heart from the outside in, a TEE is performed by placing the probe inside the body and imaging the heart from the inside out. The probe is inserted through the mouth into the esophagus, which is the tube connecting the mouth to the stomach, and pictures are taken from inside the esophagus and stomach of the heart. And by doing this, we can get much closer to certain parts of the heart, like the left-sided valves, the mitral valve, and the aortic valve, and see them in much more detail than we can with a regular ultrasound. It also allows us to see things like the left atrium in much more detail, so we can check for any blood clots that might be there before we do a procedure in there, or before we shock the heart back from atrial fibrillation, for example, into normal rhythm. So it provides a lot more detailed view of many parts of the heart compared to the regular ultrasound that we do from the outside, and that's why your cardiologist may recommend this in certain conditions. The test begins, just like any other ultrasound, with placing electrodes on the chest. That's these white stickers connected to wires that go back to the ultrasound machine, and those allow us to synchronize the pictures of your heart with the electrical signal coming from the heart. We then numb the throat using lidocaine, so you'll get a cup of solution containing lidocaine, and you'll be asked to gargle this for about 30 seconds to a minute. Now, I will warn you that it tastes terrible, and this is often the worst part of the procedure, and I'm sorry in advance for the terrible taste of the lidocaine. But this is also a very, very important step, because if we don't get the back of your throat completely numb, you're going to be uncomfortable during the procedure when the TEE ultrasound probe is back there. So do your best to gargle and then swallow this solution, because the more numb we can make you, the more comfortable you're going to feel. After you gargle the solution, we may spray some additional numbing medicine back there as well. We are then going to roll you onto your left side and give you some medicine to help you fall asleep. We usually call this light or moderate sedation. You may not be completely asleep for the entire procedure, but you should be asleep for most of it. You should be comfortable, and you probably won't remember most of it afterward. Once you're starting to get pretty sleepy, we're going to place this piece of plastic into your mouth. This is known as a bite block, and it allows us to ensure that you're not going to bite the ultrasound probe while you're sleeping or falling asleep. So it's really just for the safety of your teeth and our probe. Then we're going to insert the ultrasound probe into your mouth, and we're going to ask you if you feel any pressure in the back of your throat to try to swallow. The ultrasound probe will be straightened out. This is a view of it curled up. It's going to be straightened out. It's about the length of your arm, so it is pretty long, but usually we just put it in up to about this depth in order to get into your esophagus, and then a little deeper to get it into your stomach. And again, if you could just close your eyes, take deep breaths, and when you feel that pressure in the back of your throat, just try to swallow. The ultrasound probe should pass very easily into the esophagus, and we should be able to get started. This is an example of the kind of pictures that we can get. So very detailed views, in this case, of the mitral valve. We can do 3D reconstructions. We can look at it from all different kinds of angles. So it allows us to know very easily and in great detail if there's any kind of problem there that requires an intervention. You don't have to do anything to prepare specifically for the test other than not eat. It's very important that you not have anything to eat or drink for at least 6 hours before the test. In addition, unless your cardiologist advises you otherwise, you should take all of your usual medications on the morning of your test, just with small sips of water. And you should plan on being there for about 2 hours. The test itself really only takes about 20 to 30 minutes in most cases, but that doesn't include any of the time spent getting you into the room, getting you prepared and comfortable, and then afterward allowing you to recover from the sedation and wake up. It's very important that you have a friend or a family member be available to drive you home at the end of the test, because you're not going to be in any condition to drive once you're still waking up from the sedation. It's a very safe test. There's very minimal risk associated with this test, but there is some risk, and the risk of a serious complication is about 1 in 5,000. Serious complications include damage to the teeth, to the mouth, or to the esophagus. So if you have any dentures, you'll need to remove those first. If you have any loose teeth, you'll want to let us know about those, and we may avoid this procedure. If you have any problems with your esophagus or stomach, we'll need to know about those too. For example, a stricture in the esophagus or an ulcer in the esophagus. Anything that isn't completely treated and resolved, we're probably going to want to postpone the procedure for, because we don't want to provoke a problem that's still there. In addition, if you have a history of excessive bleeding, we'll need to know about that too. And finally, if you have sleep apnea or you've had problems with sedation in the past, we'll need to know about those because it'll affect the way that we sedate you for this procedure. So I hope that this video gives you a good overview of what to expect on the day of your TEE and helps you understand how the procedure goes and what we're looking for. Thanks very much and stay safe.